Hello everyone, today we are going to see the topic that is related with that of dysfunctional uterine bleeding. As we know that there are different types of menstrual abnormalities. This type of the menstrual abnormality is that here the bleeding is there but without any pathology as such. So what is first we are going to see what is the definition of DUB, what are the types of the DUB, what is the reason behind it, and how you are going to clinically assess the patients came with that of such type of the complaints. So first we are going to see what is DUB. DUB is a condition where there is an abnormal uterine bleeding without any pathological manifestation in genital tract and does not have a known organic cause. Irregular uterine bleeding that occurs in the absence of recognizable pelvic pathology, general medical disease, or pregnancy. And it reflects a disruption in the normal cyclical pattern of ovulatory hormonal situation to the endometrial lining. So that is the basic concept or definition of the dysfunctional uterine bleeding, that is DUB. What is meaning of it? If any patient comes to you presents with that of excess of bleeding, but if you see the all the investigations previously, there is no any pelvic pathology, then we can think about this is the DUB. Next, what is the as we see the in these diagrams, so whatever the endometrial lining, there is a lack of hormones not adequately stimulated. So as we know that whatever the growth of the endometrium, it depends upon the estrogen and progesterone. If estrogen and progesterone are giving the secreting properly, and if the endometrium cells are giving proper response to it, there is a proper growth of the endometrium, and if this proper growth of endometrium, it is shed in the normal way. This is normal concept of this one normal menstrual cycle. But if there is a lack of these hormones, then there is a improper growth of the endometrium. What it happens, what we say in this diagram, if it is growth is taking place normally, whatever the shading from takes place here, it is normal menstrual cycle. But what happens in sometimes, if the endometrium lack, the only this part it becomes improper, that is called as irregular ripening and irregular shading. What is meaning of it? In this situation, sometimes this part is developed properly, then after 15 to 20 minutes, 15 to 20 days back, this parts develop properly. After 15 to 20 days back, this part. But what happens after completing of 28 days cycle? This part sheds its, and these parts remain. Afterwards, it starts growing it, and it sheds afterwards. So what is clinically patient says presents irregular cyclical bleeding. There is no pathology as such over here, but what is problem? The growth of endometrium is not taking at proper place. How is the growth? It should be equally, growth should be takes place normally, and it should be shaded normally after 28 days. This is, that is irregular ripening. And what is irregular shading? What happen if whatever the endometrium, the growth takes place normally equally all over, but what happens if the proper hormones are not properly, the growth it is not of that quality which is present in the normal hormones. So what it leads to, in initial after 15 days this part shades off, but this part remains. After completing of 15 days, sometimes days, this part remaining shades. So what it leads to clinically, how the patient presents with that of, there is a intermenstrual, in between the bleeding is present. But is there any pathology over here? No, there is no any pathology. What is the problem? Problem lies with this endometrium proper ripening, and second, irregular shading of this. And why this is happening? Because of lack of hormones, they are not adequately stimulated. That is the part of it, why there is this happening. Now next we are going to see how much incidence. What is meaning of, if we see the 1000 patients, out of that 40 patients presents with that of DUB. And it is, what is the age group for the history taking? If we think about, the mostly it is seen in the adolescent age group and women approaching menopause. So which age group? Adolescent age group, some 15-16 years of age group. If any girl present comes to you and having such type of the symptoms, that is age group related with that of some 16, 15 to 16, or if any female comes to you of age group some near about some 40 to 50 years of age group, then we can think about the chances of DUB and how much percentage point of view. What we say it is 20% it is in the adolescent age group and 50% is in the 40 to 50 years of age group, that is this one approaching to that of menopause. So next we are going to see what are the classification of DUB. So DUB it is classified into two parts, primary DUB and secondary DUB. What is primary DUB? Here there is no detectable disease in the genital tract or elsewhere in the body. It is due to something problem with that of menstruation or ovarian cycle or what is hypothalamo pituitary ovarian axis. That is problem with that of HPOA axis. While in case of secondary DUB, disorders outside the genital tract, that is what we know that female genital tract, there is no any problem with that of over fallopian tubes, there uterus, cervix, vagina, nowhere any problem in the female genital tract. Where is the problem? Problem outside the female genital tract. What is external? Like hypothyroidism, intra-IUCD, hormones for contraception or any other use can lead to this type of the DUB. So basically what is the cause behind for this DUB? So it is divided into two parts. It is cause it is for primary DUB and cause for the secondary DUB. So what is the cause for the primary DUB? It is the disturbance in eugenoids, fibrinolytic and lysosomal enzymes. Enzymes are responsible for this enzyme system. Then ischemia and the cell death. Second, arachidonic acid and PGF2, that is vasoconstrictor and weak platelet aggregator, PGE2 vasodilator and platelet and aggregator, and TXA2 thromboxane A2 potent vasoconstrictor and platelet aggregator. In short, enzymes and this PGF2 and PGE2 are responsible for the primary DUB. So next one is the cause behind it is anovulation, that is lack of ovulation. If ovulation is not taken properly, then estrogen and progesterone are not doing and the growth of endometrium is not properly. Sometimes if there is a pituitary cancer, the HPO axis cycle gets disturbed, and hypothalamic disorder. If hypothalamus is not doing function properly, pituitary is not going to do the function properly, then ovary is not going to do the function properly, and the estrogen and progesterone are not, and the endometrium growth is not going to take place properly. While in case of adolescents, DUB can happen because they often do not ovulate as their pituitary ovarian axis is not that much of mature. While in case of premenopausal women, why it is? Because due to irregular ovulation because of their decreasing ovarian hormone production. Hormone production, as we know that as the women approaches to that of menopause age group, the production of estrogen becomes less. While what is the cause behind the secondary DUB? In secondary DUB, hormones, low dose progesterone, underdevelopment of spiral arterioles, degeneration of large venules, large dose of progesterone produce superficial dilated venules with atrophy of endometrium. If any females using the IUCD, ulceration of endometrium and increased vascularity as what we said it, and sometimes there may be problem with that there is no any some external cause like IUCD or anything. But if there is a problem with that of bleeding disorder, so which conditions can lead to like some thrombocytopenia is there or some factor 25710 deficiency is there, can lead to the secondary type of DUB. There is no any pathology in the female genital tract, but problem is other than, or if there is a hypothyroidism, that is direct effect of thyroxine can lead to such type of the problems. So this is what we say the pathophysiology. What we say in that first, that is due to alteration in the hypothalamo-pituitary axis, the corpus luteum is not formed properly. There is a failure of the cyclical secretion of progesterone. continuous unopposed production of estrogen, stimulates overgrowth of endometrium. Endometrium grows thick, overgoes its blood supply, and lastly leads to the necrosis and irregular bleeding. That is what we see, the how the pathophysiology of DUB can take place. This is what we say in this diagram. This is what we say in this over here. This is normal endometrium. It gets growth properly and it sheds normally. While in case of dysfunctional uterine bleeding, there is a hyperplasia, that is size it is increased, so there is more discharge from this situation. Here there is no, what we see, there is no any pathology, only problem with that of endometrium, which is grown more because deficiency of basic hormone, that is estrogen and progesterone. So what is first we are for understanding of this, what we require, what is normal menstrual cycle. So as we know that the normal menstrual cycle length wise it is 28 days. Age it is 20 to 27 days. Duration of it is 2 to 7 days. And if excess more than 8 days or longer, and quantity it is about 40 to 80 ml, that is normal discharge what we see in normal menstrual cycle. While in case of DUB, what are the features that what we are going to see it? It is the breast tenderness, nausea, urinary frequency, fatigue, excessive vaginal bleeding with severe pain or cramping,